What type of lens should I get with my cataract surgery? This is, of course, a very important decision, as you only have cataract surgery once in your lifetime, and the lens that you choose will be in your eye for the rest of your lifetime. There are a lot of options when it comes to the type of lens you can have placed inside your eye, and it can be quite confusing. This video is an attempt to help clarify and make things a little bit more straightforward to help you make an informed decision as to the type of lens you'd like to have. I like to think of lenses or intraocular lenses or IOLs as they're referred to that are placed inside the eye into two broad categories. Number one, a monofocal lens, a lens that focuses all the light that comes into one clear focal point. With this lens, we can often choose a lens power to optimize either your distance vision or your near vision. The other type of lens or category of lenses are multifocal lenses or extended range lenses or extended depth of focus lenses. Any type of lens that tries or attempts to give you a greater range of vision, not just one focal point. So, first point, two main types of lenses, monofocal lenses or extended range lenses, which are multifocal lenses, extended depth of focus lenses, monofocal plus lenses, any type of lens that tries to give you more than just one focal point. Within each of those categories, there are also lenses that correct astigmatism. We call these toric lenses. You can have a monofocal lens that corrects astigmatism or an extended range lens or a multifocal lens that also corrects astigmatism. Still two broad categories, monofocal on one side, extended range on the other side. I think the first step should be trying to decide whether you want a monofocal lens or a multifocal lens. Which of those two categories is best for you? That's something that your surgeon can help guide you with. Your surgeon can let you know which lenses are options for you, and then ultimately it's your choice to decide which lens you want to have placed in your eye. So there are multiple factors to consider. Number one, what is it you want? Number two, what type of lenses are you a candidate for that your doctor can recommend? Number three, what imperfections in your vision are you willing to tolerate? And number four, cost. So those are probably all factors to consider which go into deciding which type of lens you'd like to have. So let's talk first about what it is you want for your vision. Why is it important to choose the correct type of lens? The correct type of lens will determine how well you see when you're not wearing glasses. Some people really don't mind wearing glasses. If you're one of those people where you say, you know what, I just want to see better. I don't care if I have to wear glasses for distance and near. I don't care that my vision is blurred when I'm not wearing glasses. I'm going to wake up in the morning and put those glasses on. And so long as I can see clearly with my glasses on, that's all that matters to me. Then really that can really help guide you and your surgeon to making a good lens choice. In that case, in general, a monofocal lens is a perfectly good choice. You can wear glasses to correct any residual astigmatism or any residual refractive error or nearsightedness or farsightedness, and you can have good vision for distance and near with your glasses on. For many other people, though, it really would be nice to be able to see well without having to wear glasses or contact lenses. Some of my patients want to be able to see well for distance without having to wear glasses, and they don't care if they have to wear glasses for near. They don't care if things up close are blurred and they need to wear glasses to see up close. So for those patients, really optimizing the distance vision is the best way to go, and that can be accomplished with a monofocal lens, a lens that has one focal point. If they have astigmatism and they want to see well for distance, then we need to put a lens in that corrects astigmatism, and that can be a monofocal astigmatism correcting lens. If a patient comes in and tells me, I really would like to see distance and near without having to wear glasses, I would love the opportunity to see well again without having to always reach for glasses or wear contact lenses, then really a multifocal lens is probably the best option, with one exception. Patients who have had monovision, which is confusing, I know, but monovision usually refers to having one eye for distance or one eye for up close, and they may have had that done with LASIK in the past, or they may have had that done with their contact lenses, and they're happy with it, they like it, they like having one eye for distance and one eye for up close. Then you can do a monofocal lens, one focal point in each eye, one eye for distance and the other eye for up close. I do not do that unless someone comes to me and says, I've done monovision in the past. I like having one eye for distance. I like having one eye for up close, and I'm okay with that. I want to know that they are used to that kind of vision and they're happy with it before I'll consider doing that with cataract surgery. So that's one scenario. Most of us are not in that scenario. So if you have not done monovision in the past, or you haven't had one eye for distance or one eye for up close, then the next option really is to do a multifocal lens, which is a lens that splits the light as it comes into your eye over distance and near to give you a greater range of vision. And that can be really fantastic. It can offer you, once again, to be able to see distance and near, or possibly for the first time in your life, to be able to see distance and near without having to wear glasses. Pretty amazing stuff. Intolerance or disadvantage of doing an extended range of vision lens. With any lens that we put inside the eye, whether it be a monofocal or multifocal lens, there's a possibility of something called dysphotopsias, which is aberrant images or extra images around lights, such as halos or starbursts or lines through lights, and that can really happen with any lenses. But we do know that with multifocal lenses, most patients initially will see little rings or halos around the lights, around focal points of lights, or around lights at night, or around headlights or street lights. That is very common. In the vast majority of my patients, it's not something that's going to stop you from driving at night or taking road trips or doing the things that you want to do at night, but it is an artifact of the way that lens splits light over distance and near. So if you're going to have a multifocal lens, you have to be prepared for that. A multifocal lens is fantastic in that it gives you distance and near vision, but it can cause you to have dysphotopsias or artifact around lights at night. If you already know that that's something that's going to bother you, then the more conservative choice is to have a monofocal lens, optimize your distance vision, and then wear glasses to read up close. Did I mention that I wrote a book about cataract surgery and what to expect before and after cataract surgery? You'll find it in the link below. So lens technology is constantly changing. Every year there are new lenses that come out. In this video, we didn't talk about the pros and cons of any individual manufacturer or particular lens. I wanted to keep it general so you had an idea of the basic types of lens options that are available to you. With this foundation now, for the next video, we're going to talk about why there's no such thing as the distance lens or the near lens. We'll see you soon.